last session? Just superficially. Can anybody say what we have discussed in last session? Anyone?
Ma'am, structure of heart.
Good. This is Subendu, right?
Yes, ma'am.
Yes, Subendu. So structure of heart. Good. So then anybody wants to add? There is one more point.
Introduction about cardiovascular system.
Okay, even that we have discussed. Very good. Then
Position of heart.
very good. So position or location of heart. Then next, quick.
Ma'am, valves in heart.
Okay, good. Then I'm expecting one more important point.
Ma'am, voice is breaking.
Hello.
Yes, ma'am.
Yeah. So after that, what we have discussed, one more point, blood vessels. We have discussed or not? We have discussed or not?
Discussed, ma'am.
Okay. So what all the blood vessels we have discussed in last session? What all blood vessels we have discussed in last session?
Ma'am, superior vena cava,
Yes.
inferior vena cava,
Yes. One.
aortic arteries, pulmonary arteries, and pulmonary veins.
Okay. Good. So we have discussed superior vena cava, inferior vena cava, the main, so these are the veins. So then we have discussed arch of the aorta, then we have discussed pulmonary artery and pulmonary vein. So these are the main blood vessels of heart, which originates from the heart and which supplies to the heart. Okay, so apart from that, there are many more arteries which carries blood, and which also involves in the circulation. The first one, so we will continue the last session itself. Okay, so if you want to see, I'll show again. Here is a superior vena cava. Okay, here. So the inferior is on the inferior aspect. So there are 3 aortic arteries. There are pulmonary artery and pulmonary veins. So then we'll continue from carotid arteries. Carotid arteries means there are 2 on both sides of your neck. So what I want from all of you is, palpate on either side of your neck, all of you. Palpate on both sides of your neck. Okay, this part, the just below jaw, you palpate and you just be relaxed and you see whether you are feeling pulse. Some pulse you are feeling. How, when you will palpate here, what pulse you are feeling, similarly you are feeling here. Are you all able to feel?
Yes, ma'am.
Okay, so that pulse is via carotid artery. Okay, from the heart it goes to the brain. Okay, what we have discussed, blood goes to the neck and from there it goes to the head and it goes to both the upper limbs. Now from there it goes like this. The artery is called as carotid artery. That is called carotid artery. So what is the importance of feeling this artery? Whenever the accident will happen, the patient is lying on the road and he is severely injured. Okay, his upper limb, lower limb severely injured. So in that person, if you are trying to feel the pulse, why you are feeling pulse? To know whether circulation is happening or not. What is the purpose of checking pulse? The blood pressure. One thing is to confirm the circulation, whether it is happening or not. Second thing, how much, whether it is more, the beat is more or beat is less. This pulse is more or pulse is less. If it is more, then heart is pumping more, means the blood pressure is high. If the pulse is very low, means very slowly you are feeling, or the gap is more, then the heart is pumping very slowly, means your blood pressure is less, means that person's blood pressure is less. So when during the accident cases, you are not able to find easily the peripheral pulse, means your radial pulse, what the brachial pulse is there, and in the lower extremity what are the pulses are there. So those you are not able to feel. So for emergency, where you have to palpate is, you have to palpate carotid pulse to know whether circulation is happening or not happening. Second thing, to know whether brain is active, the circulation is passing to the brain or not, or brain is dead. So you have to palpate on the both the side. Just one thumb you keep on one side other two fingers you keep on the another side. So both pulses you can feel once. Okay, brain divided into two, right side of the brain, left side of the brain. So right carotid artery supplies to right side of the brain, and left carotid artery it supplies to left part of the brain. So in case of emergency, remember to check whether circulation is happening or not happening, or whether the blood is supplying to the brain or not, or brain is dead. So that is with help of carotid artery. Sometimes you will not feel the peripheral pulses. So quickly you are able to feel the pulses here. That is the clinical importance. Carotid artery, it carries oxygenated blood from aorta to the brain. Okay, where is the arch of aorta? Arch is here. So from here the artery goes is called carotid artery. So carotid arteries are again two. Okay, so right exterior carotid, interior carotid. So this you will study in anatomy. Okay, carotid artery are divided into two. One is external, second is internal. So these are the two types. So when it comes here, it divides into two. One, it goes to brain. Okay, another, it supplies to your face. One goes to brain and another one it supplies to your face and your tongue muscles, whatever this portion is there, it supplies to there. So on both the side, there are two branches, carotid artery, external and internal. One goes to brain and another one supplies to face. Next is jugular vein. Carotid artery, it takes blood to the brain. Now from the brain, blood has to come back, right? So that is with help of jugular vein. Okay, so where is the jugular vein? You can see here, this is the largest vein as well, the second largest vein. It carries deoxygenated, not oxygenated, okay? Deoxygenated blood from the brain to superior vena cava. Okay, so this is also present on the side of the neck. Can you all see?
Yes, ma'am.
Okay, so you see here, this is the artery, okay, which present inside deeper, and near to that outside present is vein. That vein is called as a jugular vein. Okay, present on both side of the neck. Artery present deeper, near to that present is jugular vein. This is also the second largest vein. And this comes here, then in the head there are very small venules that we will see later. So next, now from arch of aorta, okay, from the heart, blood goes to brain with help of two main arteries. Remember, here we are discussing major blood vessels. Okay, the main important or the larger blood vessels we are discussing here. Smaller we are not discussing. Okay, so arch of aorta, from here to the brain, how blood will go? With help of carotid arteries. On the both side there are carotid arteries which supplies to the brain. So one is internal which supplies to the face and this portion of the neck, and external directly it goes to the brain. Next is jugular vein. So from there the blood will come back with help of jugular vein and it connects with the superior vena cava. Okay, from there it goes to heart, right atrium. So now to upper extremity, there comes artery which is called as, in this system there is not mentioned, okay, there is not mentioned, but you can see subclavian arteries. Okay, just below the clavicle bone. Where is the clavicle bone? If you see in this diagram, here is the clavicle. Okay, this nerve from arch of aorta which is going up is carotid. There is another which is coming uh, just below the clavicle. Okay, the back of clavicle bone is here. So the artery it comes inside, then it's passing in the middle of the clavicle bone. So that is called subclavian artery. So it carries oxygenated blood from the aorta to the arms. So the major blood vessel which carries blood from the heart to upper extremity is by the subclavian artery. Okay, just below the clavicle present is subclavian artery, and that is why if there happened any fracture, means if the break of the bone is present at the clavicle region, the doctor will not do any surgery if it is not emergency. Okay, why? Because there is main artery which is supplying to the upper extremity. So that is a one thing, and it will heal automatically. It will take extra time, but it will heal automatically. So that is a one of the clinical importance. So subclavian artery which extend from arch of aorta and supplies to upper limb. So again in the upper extremity there is radial artery and there is ulnar artery. This you will study in detail in anatomy. Subclavian vein. Okay, now the blood is supplied. Okay, now till your tip of the finger the blood is supplied. Now from here blood has to go back. So that is with help of subclavian vein. So there are two more veins, cephalic vein and basilic vein. Okay, these are the veins from your wrist, okay, till elbow. Their joints is cephalic and basilic vein. Okay, not only elbow, till here, till arm level. Okay, their present is cephalic vein, and from there these two veins are joining with subclavian vein, and that subclavian vein it joins with the superior vena cava. Okay, these are the minor blood vessels present in the upper extremity, so that you will learn in detail in anatomy. Next, coronary artery. What is coronary artery? There are two, right coronary artery and left coronary artery. I said heart is a muscular organ, as you all know. Muscle in the sense, obviously there supplies artery, there supplies vein and there supplies nerve. So here to the heart heart muscle, the blood is supplied by coronary arteries. You can see here, these are the small arteries which present at the heart, coronary. Okay, this is the name only for the artery which present at the heart. Carry oxygenated blood to the heart muscle from the aorta. From the aorta, it branches into small arteries that is called as coronary arteries. And remember, in anatomy, this is one of 10 marks question. Okay, blood supply to the heart. There you will study again in detail. So next, cardiac vein. Opposite to coronary artery. Coronary artery gives blood. Now cardiac vein, it takes blood back to the superior vena cava. Carries deoxygenated blood from the heart muscle to superior vena cava. Okay. Next, renal. Before that, I repeat again. To neck and head supplied by two coronary, not coronary, your carotid artery. Okay, right carotid artery and left carotid artery. Okay, it takes blood to the brain, and from there comes back, the blood is carried back to the superior vena cava, that is with help of jugular vein. That's about head and neck. Now what about upper extremity? So there the blood is taken by subclavian artery. Subclavian artery will come till here, and from there the radial and ulnar artery, it supplies to all upper extremity. Now from tip of your finger, here the blood supply will end. Yes. So from there the blood is carried back by the cephalic and basilic veins, and those veins will join to the subclavian vein, and this vein will carry blood back to the superior vena cava. So then we have discussed heart. Okay, next, heart is supplied by coronary arteries, and the receiver and taking the blood back to the superior vena cava, superior vena cava is by the cardiac vein. So next, now this the upper extremity, the major blood vessel part is finished. So next we go to abdomen. Okay, abdomen and then lower extremity. So before going into this part, you just see the diagram here. Arch of the aorta. Okay, from arch of aorta, the thickest artery which goes down, okay, it divides into thoracic aorta, means where the thorax is present. The thoracic part is present. The thoracic region, the chest region is supplied by thoracic aorta. Okay, so this part is supplied by thoracic aorta. So then as it goes down, there is one more, is called abdominal aorta, which supplies to internal organs of stomach. Okay, like internal organs like stomach or liver, kidney, gallbladder. So these all supplied by abdominal aorta. This is also one of the medium large sized artery. Arch of aorta, it gives branch as thoracic aorta. So from there it comes down, okay, that supplies to your thorax part. Next, that artery continues down, supplies to abdomen called abdominal aorta. Okay, so you can see here, so this is the stomach and this part is supplied by abdominal aorta. So now in the abdomen, it also gives branch. Okay, the artery again gives a branch, aorta gives branch, and that is called as artery, supplies to kidneys, both side of kidneys. Aorta means it is the largest artery. Okay, largest blood vessel is called aorta, which carries oxygenated blood, is aorta. So that will divide, means that when it goes down, the size, the largeness, the thickness of the artery, the size of the artery will reduce. That is called artery. So that artery from the abdominal aorta, it branches, supplies to kidney, is called renal artery. It carries oxygenated blood from aorta to the kidney. Okay, so abdominal aorta, it branches, supplies to kidney, called as kidney renal arteries. Renal vein. From the kidney, the blood is carrying back by the renal veins. Carries deoxygenated blood from the kidney to inferior vena cava. Okay, so inferiorly, which the largest, second largest vein is present is inferior vena cava. So from the kidney, it gives blood back to the inferior vena cava. So next, still when you go down of kidney, so that part is supplied by iliac artery. So this branch is called iliac artery. From arch of aorta, the artery has come down, supplied to thorax, is called thoracic aorta. Still the artery came down and it supplied to abdominal organs, and that is called as abdominal aorta. Okay, and from abdominal aorta, again that main artery divides back into branches, and that supplies to the stomach, supplies to the liver, so different organs. And one of the main division is kidney, so that is called renal artery. So next, now at the pelvis region, it will divide, because there are two there are two lower limbs, not the upper limbs, there are two lower limbs. So to supply the blood to both the lower limbs, artery will divide here. So that division of the artery is called iliac arteries on both the side. Okay, there are two iliac arteries. Okay, oxygenated blood from aorta. Okay, which aorta here? You can write abdominal aorta. So abdominal aorta to lower body means lower part of the body. Now here starts blood supply to the lower limb. Okay, in the upper limb, the blood supply started from subclavian artery, and here it starts from iliac artery. So you can see here, this is the division. So now I keep on saying, you just imagine, so it will be easy for you to remember the name. So next is branches of iliac artery. Now what iliac artery will do, it gives branches. Okay, one is femoral artery and another one is tibial artery. So now here is the, don't look into all these things. Okay, so if you start reading now, you will get confused. There will be having more chances for getting confused. So this diagram is important. At least you can refer it later as one by one topic when in anatomy will be covered. So it will be easy for you. So now here the iliac artery is here. Okay, which is a branch of abdominal aorta. Iliac artery is here. Now the artery is coming down and that is called as femoral artery. So, okay, your thigh part is supplied by your femoral artery, where the femur bone starts, where it ends. That so throughout that area is supplied by femoral artery. So that also is having branches external and internal. So that is not required now. So next, as it goes down from the knee down, okay, where the tibial bone is present, so they are supplied by tibial artery. There is also having anterior tibial artery, posterior tibial artery, means your front of leg is supplied by one artery, means it will divide. Back of leg is supplied by one more artery. So that is called posterior. So as you go down, there is also present the one more important artery, that is called dorsalis pedis artery. Dorsalis pedis artery. You all can do one thing now. Just in your foot, find out this area, and you just keep your two fingers smoothly over that area, and you see whether you are feeling pulse. That artery is very important. Why? Because in upper extremity, you will check pulse using radial artery, but in lower extremity, where you will check? You are checking very common artery, that is dorsalis pedis artery. The first artery to feel the pulse in the lower extremity is dorsalis pedis artery. You all found dorsum of the foot. Okay, on the posterior, yeah, the dorsal part of the foot. Just keep your finger and you just feel whether you are able to feel that sensation. Yes, because I can't show you. Okay, with my foot. Have you all found? Have you all
Yes,
found?
ma'am.
Everybody? Everybody? Okay, then
Yes,
fine. Okay, fine. So that is the one of the important artery for the pulsation in the lower extremity. So now iliac artery, it branches into two, femoral artery and tibial artery. So then the one more important is dorsalis pedis artery. So now before going into here, okay. So now from the distalmost part of the body, okay, from the tip of your toes, the blood is carried back to the iliac vein is with help of tibial vein. Okay, the distalmost part is tibial vein. and from the tibial vein it gives blood to the femoral vein. It gives blood to femoral vein, and femoral vein gives blood to iliac vein. So these two are the reverse branches of iliac vein. Vein always start from distal, it goes to proximal. But artery start from proximal, goes to distal. So now here, tibial vein, it gives blood to femoral vein. Now the femoral vein gives blood to iliac vein. So carries deoxygenated blood from lower body to inferior vena cava. Now iliac vein, it goes up, it gives to renal vein. Renal vein, it goes up, it gives blood to inferior vena cava. Okay, so apart from these, there are also small like small saphenous vein, tibial vein, popliteal vein, great saphenous vein, femoral vein is here. I can see femoral vein. One artery, it will branch into 2, 3, like the different names are there that you will study, as I said, in subject anatomy. Okay, so now from arch of aorta, blood is coming down. It supplies to thoracic part called thoracic aorta. As it comes down, it supplies to abdomen, which is called as abdominal aorta, and it comes till pelvis, and at the pelvis it will divide because there are two lower extremities. It supplies to both the limbs. So that division is called as iliac artery. So now this iliac artery, when it goes down at the femur region, it divides, is called femoral artery, and as it goes down it supplies to leg, that is called as tibial artery, and as goes down there is one more important, I said, dorsalis pedis artery, and there is also tibial artery, posterior tibial artery. So now from here it comes up, the blood comes up by the tibial vein. This is artery. Okay, I will write artery as a circle. So next, in the femur, it's by femoral vein. Same, but the name is different. Instead of artery, it is vein. And here it is iliac vein. So it comes up, one thing I missed, that is renal artery. It joins with renal artery while coming down, and while going up it joins with the renal vein and it carries to inferior vena cava. These are the main blood vessels present in the human body. Okay, so those are the major blood vessels. Okay, so before that, so let's have one task. Okay, so what I need from all of you is, I'll write major blood vessels. I'll write here uh, upper limb, abdomen, and lower extremity. Okay. So how many are present now? Oh my God. Can you all see? Oh, 118. Okay, you all read whatever we have discussed till now. I'll ask the questions after 5 minutes.